from this presentation, he has a bias in health technologies, and I'm hoping that we are going to enjoy. So up to this point, Arthur Imari is joining us from Kigali, Rwanda, and he's also the SG for Lab Medicine Society of Kenya. So I'm hoping that we are going to enjoy, and he's going to share with us this very, very important topic that which I've said will focus on managing, validating, and verifying medical lab technologies and supplies. So we know that we are living in a rapidly evolving medical technologies, and there is increasing diagnostic demand. And so there's need for robust systems to manage, validate, and verify lab technologies. So I'm hoping that we are going to enjoy. And Arthur, if you can hear me, you can say hi, and maybe you can proceed. Arthur, can you hear me?
Yes, I'm able to hear you. I don't know if you are able to hear me as well.
Very good. We can hear you very well. You can proceed.
Okay, thank you, Fred, for allowing me to be the presenter today in this good platform of trainings. This is Lab Medicine Society of Kenya, the way Fred has told you. My name is Arthur Mari, and today I'm bringing you a very informative topic that we need to, all of us, we need to talk about and understand what it means to have knowledge on how to manage your commodities, how to manage your equipment, and how to also manage the technology that comes with the equipment that you're having at your workplace. So our objective today, where you can see, is we want to, at least at the end of this session, how to or how to strengthen laboratory quality systems, and how to make sure that your operations are efficient and compliant to the international standards, as well as the national and the local standards that we're having from different regulatory bodies that you're having in our country. As you know, behind every laboratory result is a patient waiting, hoping, trusting in our expertise as laboratory personnel. So today, I invite you so that we can look at this collective expertise in equipment and supply chain management and how it shapes the outcome of laboratory results. Diagnostic drives nearly 70% of medical decisions, and our role has never been any less critical the way we know it. It has been very critical, and yet, amid all this critical nature of our work, we still face a number of challenges in our workplace. For example, these are some of the challenges that we are facing in our everyday, day-to-day activities in our laboratories, different labs in this country. As you all know, that whenever a patient comes, the patient is waiting for quality results. They are hoping, trusting in our expertise, because diagnostic drives nearly 70% of medical decisions. Yeah. Yet we still face persistent challenges. For example, we still have skill gaps in equipment and logistic operations. We still have supply chain disruptions, which at the end of the day delay even critical care. We have poor temperature controls, and this one undermines reliability of our in vitro diagnostics, and also other areas of our practice. Equipment breakdown is this one today appears like a routine thing in our labs. Supply chain inefficiencies. Every now and then we have got stock outs, community stock outs, equipment reliability issues. We have equipments that normally don't even pass the QCs that we have, and yet we are expected to give quality results. We also have limited resources and delayed procurement, very long lead time when we are doing procurement for our different commodities. And also we have different companies with very inconsistent product quality. As you can see in many areas that we have commodities, but from different companies, but the quality are totally different. That's why we've seen it wise to always ensure that we do the QCs to make sure that our commodities are good and we are able to give better results. Now, we want to look at another area in our journey. And so we're looking at three key areas that we need to ensure that we are abreast with when we are dealing with management of health products, especially medical laboratory supplies and the technologies that come with these health products. So we have three key areas. One, we have the sustainable laboratory systems. And two, we have the capacity building framework. And three, we have the resilient healthcare feature. So these three areas are very key to our practice and how we do things. For example, you're looking at the sustainable laboratory systems, and you see that here we're talking about efficient, environmentally responsible, and adaptable diagnostic environment. And when we're looking at capacity building framework, then we are looking at a system whereby we are able to develop people and personnel and processes for operational excellence. We are able to capacity build personnel that are able to give us quality results. And then when we look at resilient healthcare systems, these are systems that are able to withstand hardship, but at the end of the day, they are able to give quality results amid all these hardship environment. So those are the systems that we are supposed to create. Those are the systems that we are supposed to work with. When you look at the resilient healthcare feature, then these are the integrated systems that withstand disruption and sustain quality. So when we're talking about that, then you now understand well what is needed of us as medical laboratory professional. As we proceed, we're looking at this area, and before we look at how to design these sustainable systems, let's look at some of these, some of very important abbreviations, some key terms that we'll be using when we're talking about equipment and in vitro diagnostic products in our labs. For example, there's one word that we always come across, like validation. What does it mean when you talk of validation of equipment? So generally, this is what we do. When you're talking about validation, it means that we confirm specification and make sure that these specifications are able to meet the user needs. That one is in simple terms. And how do we do that? We do that, one, by simulation, and two, we do it through pilot testing. Two, we also have another very important term when we are referring to proper equipment management, and that is verification. So in simple terms, when you talk about verification, then we mean the actual assurance of compliance before acceptance. That is, before we accept a machine, for example, when we purchase a new machine, then we have to ensure that it is verified, that it is working well. So that is the most important part that we needed to understand as we move forward. So in this other area of our discussion, we are looking at how do we design these sustainable laboratory systems? That is, how do we create laboratories for the future? Which means we need to think beyond just the reagents, and also it's about building system where efficiency, accuracy, and accountability meets. So those are some of the key areas that we need to ensure that we are at par with. So when we're talking about efficiency or efficient, this is where we have got, this is where we are supported by accurate consumption, data, and forecasting. That is where we're talking about efficiency. And when you talk about environmentally responsible, then we are talking about reducing wastage and managing products life cycles effectively. And when we're talking about adaptable, then we're referring to responsive to evolving testing needs and products innovation. As you know, laboratory medicine is dynamic and it keeps changing every day. And so, as a country and as a cadre and as a profession, we also need to keep changing every day as we improve on our diagnostic skills. Therefore, those are three key areas that when we want to design a sustainable laboratory system, we have to ensure that we are taking care of. So, another point to note is that effective inventory control and products validation prevent stocks outs and expiries. This one, ensuring that every diagnostic test uses verified high quality reagents and supplies. By that, it means a sustainable lab is one where efficiency, accuracy, accountability meets, just the way we have indicated in the other discussion that we've had. So we want to look at something here to do with equipment procurement process, because most of our challenges start right from the point of purchasing an equipment. If we don't get it right when we are purchasing an equipment, then that is where we start getting it wrong. So we need to do it right from the very point where we are purchasing the equipment. For example, when you're talking about an equipment, then we are looking at the life cycle of an equipment and how to manage that particular life cycle. Think of an equipment not as a purchase. That is what you need to understand, but as a partnership between the suppliers, users, and the systems. So that is very important for us. So when we looking at the different areas that we need to look at, we first start by looking at the steps in procurement process. One, the need assessment. Why do we need these equipment? So ideally, you need to do a need assessment within 2 weeks. That is during 14 days. That one is enough for you to do a proper need assessment so that you know why you are buying this particular equipment and what it will be used for. Then two, the specification development. You need to, once you've done the need assessment, then you need to have put in place the specifications that you want for that particular equipment. So when you're talking about the specifications, then this one, you need to develop the specs for 2 to 4 weeks. You need to develop the specification. This is after you've done a lot of consultation, you've done a lot of window shopping so that you know the right equipment and the right specification that is able to perform as per your needs. Then you look at the tender advertisement. This one you do within for a period of around 1 month. Averagely, you're able to do a tender advertisement. Then bid submission and evaluation. Then you need to look at the bids that have been submitted by the different vendors and you evaluate them. Then you award that contract to that particular company or vendor that you agree that is going to deliver the equipment. Then that equipment is delivered and installed. So in all these processes, it is important to understand the importance of every of these processes. Otherwise, as you move on, if you don't follow this particular process, then you will after some time, and you're not able, one, to get the spare parts. Two, you will not be able to get the reagents that you need, and those are the challenges that we are trying to avoid, so that when you buy this equipment, then you are sure you are able to get the reagents easily, you are able to do servicing easily, and the warranty is guaranteed. As you also look at the vendors pre-qualification, these are checklists that can help you to ensure that you get the right vendor. For example, that vendor needs to be regularized. There need to be a valid regulatory certificate from the regulatory body, for example, from the KMLTTB. Then you'll also look at the vendor's uh, experience in lab equipment sales and installation. For example, averagely 3 years is good enough for you to understand that that vendor is good. And then another thing is a proven after sales services presence in Kenya. It's very much important to look at that particular area. And then another area to look at is the manufacturer's authorization letter, very important. And you also look at the warranty and spare parts and reagents availability for at least the next 5 years, very important. And then you also look at the referees. At least that vendor should bring you to referee letters from health institutions where they have been they have supplied machines to. This one will help you to validate them and be sure that it's a good company. Also, when we are also ensuring that we get the right equipment, then these are some of the things that we need to ensure that we are abreast with. For example, when we're doing the supply vetting, our goal is to ensure quality, reliability, and service capability from trusted partners. So which actions do we ensure that we do? One, we evaluate the supplier certification and track records. And then two, we also assess products quality and technical support. Then three, we also approve only suppliers meeting compliance and service standards. That is one. Then two, we also look at the reagent compatibility. Many times we buy reagents which are not compatible with the machines we are having. At the end of the day, we end up losing money. So to avoid this, then we make sure that we validate that reagents and materials work seamlessly with the equipment. We need to have this information. So how do we do it? We conduct validation protocols. We confirm accuracy, consistency, and compatibility. And we also maintain documentation for future references. And then three, we also look at performance tracking. Here, we use data-driven insights to monitor equipment efficiency and inform future procurement. How do we do it? We record key performance indicators, and we also analyze downtime, throughput, and results accuracy. And lastly, we use trends to guide suppliers and equipment choices. And then our last bit is the preventive maintenance. We need to have a plan on how to make sure that we prevent downtime and we prevent machines, equipment from breaking down. So this is the kind of maintenance that we need to prioritize. So preventive maintenance, how do we, what is the goal for this? When we schedule regular servicing, this one reduces downtime of this particular equipment and also extends the equipment lifespan. And how do we do it? We implement the manufacturer's recommended action plan. For example, if the manufacturer has recommended particular reagents, those are the type of reagents that we need to use. If the manufacturer has recommended a particular temperature and maybe the environment away from dust and maybe the technical knowledge on how to operate that particular machine, then these are the particular areas that we need to ensure we prioritize. Another area to prioritize on is we need to feed maintenance data back into performance tracking and supplier evaluation. That is very much important. So another point that we need to know when it comes to equipment management in terms of the reagents that they're using and how to ensure that these equipments are working effectively is to assess the fitness for purpose. How do we assess? And as we assess the fitness for purpose, we also need to ensure safety, reliability, efficiency throughout the life cycle of this particular equipment. One, we need to evaluate this process. How do we do it? We need to define the need and objective of why we need this particular machine. We need to identify options. What are the alternative models for this particular equipment? Then we also need to collect technical, clinical, and cost data. We also need to assess performance from even previous machines or maybe other facilities which are using this particular machine. We also need to compare alternatives in terms of cost. What other alternatives do we have? And then we also need to make recommendations. And here, lastly, we also need to monitor cost procurement. That is, once we procure this particular machine, what other costs are we likely to incur after buying this particular machine? Many times we only think that the only cost when we talking about procuring machine is the cost of buying that particular machine. But you might be surprised to realize that maybe the cost of maintaining that particular machine is higher than even the cost of buying that particular machine. Sometimes a machine can be cheaper, but the cost of maintenance is higher. Sometimes a machine can be very expensive, but the cost of maintenance is very low. So as you plan to purchase a good machine, you need to understand these factors well. Then, what requirements are we supposed to also factor in when we are bringing in a machine for high performance? One, we need to look at the functional aspect of that particular machine. How is it performing? What is the output? We also need to look at the technical, that is the power, which power source will it be using, the compatibility, and also the maintenance. Then we also need to look at the safety aspect. That is, how safe are we as personnel working with that particular machine? How safe is the environment where that particular machine is placed? What harm can we get from maybe being exposed to that machine for long? Those are details that we need to also check on. When we talk about safety, we're also looking at the standard compliance, the issues like alarms, in case maybe the temperatures have fluctuated. Do we have an alarm system to also ensure that the staff who are working there are informed? Do we have infection control when you are using that machine? For example, you have a hood, a biosafety cabinet. Is it functional? Because you might be having a biosafety cabinet, but it has not been installed properly. So the aspect, for example, of infection control is not guaranteed. So those are areas that we need to check. Also, environment. That is the site and the condition. How is the room in terms of maybe the ceiling, the dust, and all that? We also look at the user-related aspects. For example, training and the ergonomics. Are the staff trained? Is it user-friendly for the staff? And economics as well. So we're looking at the cost, the life cycle, financing. Those are areas that we must make sure we are able to secure when we are talking about ensuring that our machines are high performing. We also want to look at, before we get into this cold chain reliability, allow me to also expand something on this medical equipment validation. There's this thing that we call calibration. It is very much important for every machine that you're having in the lab. For example, when you're talking about calibration, then we need to understand the meaning and why it is important. Because calibration and initial testing of medical laboratory equipment, this one involves comparing instruments to a known standard to ensure accuracy, reliability, and proper function before it is used for patient testing. This process includes checking the equipment performance against predefined specifications, making necessary adjustments, and documenting the results to ensure the device meets regulatory standards. This is very much important. you cannot afford to start operating a machine without a calibration report filed in the lab. If it is not on a hard copy, then it is on a soft copy. For any audit purpose or any future reference, this particular report needs to be there so that you're able to at least be assured that what you are doing when you're working with this particular machine, then it is working optimally. Allow me to take you again to this other area. So this is the area of cold chain. Cold chain, when you're talking about cold chain in the lab, this is an area that is very much important for us. When we're talking about cold chain in the lab, very much important for us. Most of our reagents are always under cold chain, as you all know. For example, when you're talking about the antiserums, we always operate using the antiserums, but they have to be under cold chain and so many serological tests. So many a times we've also seen a situation whereby we are not able to ascertain the refrigeration temperatures. But when you open that particular fridge, then you have got reagents inside. So we want to understand why it is important to ensure that our cold chain systems are reliable. You see, just the way we're saying, the heartbeat of diagnostic confidence lies in our cold chain systems. For example, we're looking at this area of cold chain, and we are seeing something very important here. One, they're saying that temperature exertion compromise not just reagents, but results. That is true. Precision in cold chain management safeguards patients' outcomes and builds public trust. This is very much important. And all these happens courtesy of a good cold chain system. When you're talking about the good cold chain system, then we're looking at continuous monitoring. How many times do we monitor our cold chain? How many times do we even track our refrigerators and our freezers with the products inside? And how many times do we do QCs on the products that we've kept on the in our cold chain system for long to make sure that their potency has been maintained from the time we check them in to the time that you are doing that particular QC, or maybe you're doing that kind of verification again. So we're looking at continuous monitoring, very much important. So real-time temperature tracking system within 24 hours, 24/7 surveillance capability. It is very much important. Whether you are working during the day or working during the night, it is important that the cold chain system is monitored and it is optimum as required. Then we also need to have an alarm response protocol. So this is very much important. I know many laboratories, they don't have this one, but it is very much important that we have an alarm response protocol where immediate action plans when temperature thresholds are breached. It is important that anytime the alarm maybe alerts you that maybe the temperatures have gone so high or the temperatures have gone so low, beyond the optimum temperatures that are needed, then you need to be alerted. So 3, we also have the equipment validation, regular inspection and calibration of cold storage units. So I'm posing a question to us. How many of us have ever done calibration to our refrigerators and our freezers? How many times have we calibrated? How many times have we calibrated our refrigerators to ensure that the temperature they are giving is correct, and if that comparison is done to another ISO satisfied laboratory, then it will give the exact temperature. So we need to do calibration and then qualified logistics. Now here we're talking about a system whereby partners are able to maintain temperature integrity throughout the last mile. What are we referring to last mile? We're talking about when from the point of where the supplier leaves the warehouse with the commodities need to be on a guaranteed cold chain system up to the last mile. That is the point of delivery. They need to be under cold chain. So how many times do we ascertain that these products have been under cold chain throughout the process, the logistics process? Do we really verify the cold chain status when we are receiving products from nets, we are receiving products from local suppliers and all that? Do we verify? So another point to understand when you're talking about cold chain is in resilience, when you're talking about good structures of the lab, temperature control is not a detail. It is the difference between accuracy and failure. Now, the cold chain is the heartbeat of diagnostic confidence. Very much important for us to understand that. That's why we say temperature exertions compromise not just reagent, but results. So reliable systems require that we have continuous temperature monitoring. 2, we have alarm response protocol. 3, we have what inspection and validation of cold storage equipment. And 3, we have qualified logistic partners who maintain temperature integrity throughout the last mile. This precision safeguards patients' outcomes and builds public trust. Let's proceed and look at this other area of supply preparation amid the current challenges that we're facing. And so this is also a very important area in our practice as we manage products, laboratory products and technologies. We need to look at different areas. And so when we're talking about these areas, we're looking at sustainability and how and what we demand when we're talking about sustainability. One, every downtime, every cold chain failure chips away at healthcare resilience. And that is what we know. We need to transform these weaknesses into opportunities. One, when you're talking about supply chain integration, then we're looking at from forecasting to final disposal. We want to have a system that is integrated. This integration ensures laboratories never operate in isolation. And the key skills here involve: 1, we have what we call average monthly consumption. This one, we're talking about tracking to inform accurate forecasting. How much do you consume in a month? How much do you consume within a quarter? You need to have that knowledge and how to calculate the average monthly consumption. We also need to understand quantification. How do you quantify when you want to do an order? How do you quantify? How do you calculate? You need to have that math. We also need to look at the lead time analysis to prevent shortages and overstocking. Many a times we realize that we receive commodities which expire on us. Why? Because we overstocked. Many a times it's courtesy of poor forecasting and poor quantification. We need to have this knowledge. Procurement planning based on data, not guesswork. When we are ordering commodities, we need to have data to support our order. For example, you've ordered 1,000 pieces of MRDT, for example, and your consumption is 100 MRDT in a month. I mean, if you don't do a negative adjustment in the future, then of course you will have expiries to explain at the end of the 3 months or a quarter. So it's very much important. Then quality inspection and product validation at every receipt. Whenever you are receiving products, we need to do quality inspection. When laboratory teams, procurement officers, and logistic experts collaborate, efficiency, diagnostic reliability become inseparable. I don't know in your facilities if you people always collaborate with these entities whenever you're doing orders for the lab. I know sometimes there's a lot of politics in our government institutions, but as the laboratory department, you need to be at the core. Whenever you ordering equipment, you need to give your opinion, and your opinion needs to count so that you don't experience the push system where the procurement department simply goes to and buys the commodities on your behalf. All the facility in charge just moves and buys the commodities on your behalf. And so you have no say. You need to have a say because you are the expert, and you need to advise the procurement and the administration on the quality of commodities that you want. So it is very much important here. Let's proceed. So just the way we've looked at this area, as you can see, we have a lot of challenges that we face in this process. Like, for example, equipment breakdown, uh, poor forecasting, and also very poor performance from our suppliers. And because of the weak systems that we normally have in our labs, where we cannot do the FIFO and the FIFO well, then we end up experiencing a lot of expiries in our department. And remember, most of our governments are not willing to even spend money to destroy these expiries. So these expiries at the end of the day are stored at some corner of the lab. So they end up occupying a lot of space in our laboratories, making our laboratories a bit untidy. And also they pose as hiding places for most of the rodents in the labs. So those are issues that you need to work on. In this process, you also need to have knowledge and understanding a little bit of what is important when you're talking about store management and some of the terms that we use on a daily basis in our store. For example, average monthly consumption. What do we understand about average monthly consumption? Under key inventory management metrics, it indicates average quantity of a particular supply or reagents used per month over a defined period. It is very much important to understand that. So what is the importance? It predicts future demands and determines the order level. It tells you or dictates to you when should you do an order. It tells you when you are supposed to do an order. So how do you calculate it? Generally on a simple way, how we calculate average monthly consumption, we take at least 3 months. Averagely, we take 3 months. Total consumption with that particular 3 months. And then we divide by 3. The total consumption of those 3 months, then we divide by 3. That one gives us averagely what do we consume in a month. Because of uncertainties and fluctuation in patient maybe care, sometimes in 1 month you might realize that there was an outbreak of a particular disease, and so maybe that test, you did so much of that particular test, but then the next maybe 2 high activities of high testing of that particular disease, then you will realize that you will have a very inaccurate prediction of what you are supposed to have. But it is important that you have this knowledge so that averagely you are aware of what you need to do. We're looking also at the lead time. What is lead time? Average lead time is time, and generally we measure it in months between placing an order and receiving the supply. That time when you place an order and you are receiving supplies, it is very much important. But sometimes lead time is in days, weeks, or months. And just the way I've told you, it prevents stock outs. And so if you know your supplier's lead time, you can reorder early enough to receive supply before exceeding the stock run outs. Without knowing lead time, orders may arrive too late, causing test interruptions and delayed patient results. Example, if a reagent takes 4 weeks to arrive and your stock will only last 3 weeks, you should have reordered 1 week ago. That is very much important here. So how do you calculate the lead time? For example, when we want the lead time to calculate the lead time in months, then we take the number of days and then we divide by uh, 30 days averagely in a month. Then that one will give us the lead time in months. Because sometimes our lead time can go maybe beyond maybe 2 months and all that. So we need to use that kind of formula to understand the lead time. Then we also have the safety stock. So when you're talking about the safety stock, also called as the buffer stock, it is the extra quantity of supply kept on hand to protect the laboratory against unexpected increases in consumptions, delay in delivery, and or supplies chain disruption. For example, your lab normally uses 300 test kits per month, and delivery usually takes 1 month. But 1 month, the supplier delays by 2 extra weeks, or your testing volume suddenly increases. Without safety stock, you will run out of kits and have to suspend what? And you have to suspend what? You are testing. So this is a buffer stock. That is why generally when we doing the order, then we do maybe a 3 month order plus 1 extra month. So that extra month is what we call the safety stock. So that is why normally we do 3 months and then we add 1 month. So that 1 month is a safety stock to caution you from any uncertainty, maybe high demand of that particular test, or maybe delay in supplies. So that one will take care of that kind of period. So we also have the review period. So what do we talk about? What do we mean by review period? Routinely, we normally have review period. So this is the time between two stock reviews, usually monthly or quarterly. So the review period is very much important when you are talking about product management. Uh, so, um, so how often the lab checks stock levels and decides when that to place new orders or not? So you need to have routine review periods. Maybe you say that you're going to review your stock after every monthly. So after monthly, you look at your order, your stock, your physical count, and then you're able to see, am I safe or I need to do a reorder? So once you've done the review period, that is what will dictate if you're doing a reorder or you are good to go. Another area is the reorder level. So when you talk about reorder level, the stock levels at which a new order must be placed to avoid stock out before new supplies arrive. So when you had already done an order, but then the orders have not arrived as per your contract with the supplier. However, you've realized that in the process of you doing a review period, your review, then you've realized that your commodities will not run the lab up to the date when you need to be receiving your next supplies from the supplier. What do? Then you reorder. So that is what we call as a reorder level. And how do you normally calculate it? Do we do the average weekly consumption or maybe monthly consumption, whatever, times the lead time? For example, if you're working on the weeks, then the lead times in weeks plus the safety stock. So once you've done that, then you are able to know what you need to order. It is very much important that way. So as we proceed, there is also something important for us to also understand here, and we call it the comprehensive capacity building framework. And what is comprehensive capacity building framework in this particular case? This is a very interesting area for us to also understand very well here. One, when we're talking about a comprehensive capacity building framework, then building capacity means developing both people and processes. I think we agree that that is important, that as we develop processes, you also need to develop skills to maintain these processes. To those who have worked in ISO certified labs, I think you get me well. You understand when we're talking about processes and people. When we're talking about processes, they need to go hand in hand with the people. One, we have curriculum reform. When you want to build processes to our professionals, then we need to look at our curriculum. In looking at our curriculum, we need to ensure that we blend the technical skills applied management knowledge. So we need to combine theory plus hands-on training. And this includes equipment life cycle understanding. Many trainings, we normally have a lot of theory, but then the practical part of it lacks. I know in our colleges, rarely are we trained much about equipment maintenance and how to ensure that we are able to fast track and maintain a good life cycle for every equipment that we have in the lab. We don't have a vast unit to teach this. And so these are areas that our learning institutions need to come out and embrace. So as we combine this, it is also important that we emphasize cold chain and diagnostic reliability in our continuous professional development. And so when we are also looking at the lifelong learning continuously, this one keeps professionals at the cutting edge. Like, for example, what we are doing now, it's a learning process that we are embracing. And so it's giving us more knowledge continuously. And mentorship bridges knowledge across generations. We also need to mentor young people so that we pass this knowledge. Policy framework provides structures for growth. This is very much important as well. So we also have issues of mentorship programs. That is, in short, in simple terms, talking about knowledge transfer, where we connect experienced professionals with newcomers. Here, we also build practical equipment management skills. We use structured guidance and regular meetings to pass this kind of knowledge as well. And then, on the same area, we also have, we need to also develop tomorrow's laboratory leaders. It's very much important. And we can only do this through mentorship. And then policy framework. This one identifies gaps in equipment management and career growth. It creates career pathway for supply chain and equipment expertise. So we also need, as a profession, we also need to have personnel to have good knowledge on how to troubleshoot and how to manage our equipment, so that not every small detail then we have to run to maybe to a biomed to maybe troubleshoot for us. We need this knowledge. Otherwise, how do you work with a machine that even a slight breakdown, then you are grounded and you cannot do any other thing? Don't you think that is important that we have this knowledge for this particular thing? So it is important that we understand that a sustainable diagnostic ecosystem thrives when professionals master both science and system stewardship. Here, resilience is built on systems, and systems are sustained by capacities. So when we have the knowledge, then we are able to sustain the good structures that we build. So if we have built very good structures in the lab, but we lack the knowledge and the skills to maintain them, that is where you understand that our labs goes back to being very poor performing labs even after an accreditation process. If the personnel were never capacity built well, or you've seen instances whereby we have got transfers, and so labs are not able to perform as per the standards that they have been positioned, because maybe particular personnel were transferred, and so they left with the knowledge. So how do we make sure that that knowledge remains? So every staff needs to be capacity built. So this one also, we look at resilience without policy backing is fragile. So when we're talking about good laboratory structures, then these ones should be backed by policy, and policy transform good practice into national standards. So we need to look at policy that is developed at the uh, county level and even the national level. So these are 4 areas: that is curriculum reform, mentorship programs, continuous professional development, like the CPT that we're doing now, and also supportive policy framework. This one at the county level and also at the national level. Very much important. And so we also build resilience through collaboration. So here we're talking about every stakeholder, and every stakeholder is able to add, is able looking at we build resilient through collaboration. Every stakeholder adds a pillar, the way we've said it here. And so we're saying that every improved results, every reduced downtime, these are sustainability in action. We hold the tools to sustain diagnostic and the responsibility to use them wisely. So when we're building a resilient healthcare feature, we identify key problems, we envision empowered professionals, we build partnerships, we define measurable sustainability outcomes, and we empower medical laboratory professionals with all these within all these areas. So when the medical laboratory professionals are empowered on matters on how to deal, manage our equipment and also manage our other in vitro diagnostics, then this one is a catalyst for sustainability. This one, we will be able to blend science and management. So by synchronizing laboratory and logistics systems, uh, we are able to sustain resilience in our laboratory practice. In addition, education and professional development lay the foundation for global sustainable practice. We cannot afford to uh, wish away capacity building in terms of knowledge when you're talking about um, managing health products, and particularly the laboratory supplies and the technologies that come with the equipment that we're using. We need to have good knowledge on that. So just the way you're able to see, we need to have empowered professionals as well. We need also to have stakeholders collaboration. So here we look at the Ministry of Health, we're looking at Akamuso, LMSK, FIA, MLS, we're looking at the academia and the private practice. So these are partners whom, if we come together as lab medicine fraternity, then we are able to ensure that we are in a good position to sustain our systems and make them work for us. And how do we measure the outcome of a capacity building and good systems in the lab? How do we measure progress transforming healthcare? How do we measure? Progress must be measurable. That is important. And so we need to have indicators that we are able to say that these indicators are impacting our lives directly. That is real time. So, for example, if you go to your lab and you realize that you can audit and have a report with still and with at least 80% stock out reduction, you've reduced stock out by 80%. I know those instances whereby you go to a patient is sent to the lab and you want to do some test and then you are told that this is OS out of stock, and you also told this is out of stock, this is out of stock, and the patient has paid. So we want to those are very broken systems, and so we want to make sure that these systems are no longer with us. We want to have systems that are working. One, we need to see an outcome in your lab whereby stock outs are reduced by at least 85%. Two, we're looking at equipment uptime. Most of our equipment, you go to a lab, you realize maybe the only machine that is working is a centrifuge and a microscope. And so you look at the full hemogram machine, they'll tell you that it has not been serviced, that the full hemogram machine too, maybe it is broken. 3, it doesn't have reagent, or instances whereby the full hemogram machine, when it has the reagent, then it has not been serviced. But when now it is serviced, now the reagents have expired. So when you do your order and the county brings the reagent, then the service period has elapsed. And so this equipment again needs to be serviced. So when the engineers come again to service, then the reagents that were brought have again expired. And so the cycle continues. Now, this is what you're saying that we need to avoid. At least we need to increase the uptake and the performance of our equipment by around 60%, at least 60%. And then 3, we need to reduce our expiries. Currently, our expiries are very high. I've seen instances whereby we can't even control the expiries. Of course, some expiries are beyond us. For example, if an order was done and maybe there was a push system and you received maybe 1,000 MRGT with maybe a short expiry of 1 month. And so by the time you are consuming 300, that expiry has reached. And so 700s are expiring on you. That is what we call expiry reduction. How do we reduce expiries? We need to reduce these expiries. So when we monitor our system and we've seen that our expiries have reduced, you need to know before maybe you started championing these systems management and maybe the product management, how are the expiry? What was the percentage of expiries per a commodity? And then after you've started now managing these commodities the right way, you also need to look at the outcome. What is the progress? What is the expiry? Is it something higher than 40% or that? And so those are areas that we need to look at. Then we also need to look at 95% quality verification, product meeting validation and standards at receipt. How many times do we receive products, but then the specifications that we had put in place are not met? But we receive them because maybe it's an order from the chief officer who has told you to receive those particular products. Or your CMLC has told you to receive. Just receive. Either we follow up maybe next week or whatever. So we need to receive commodities and equipment with 95% verification scores. At least the specifications we had placed should be at least 95% tallying. It's very much important. So, and so when we're talking about resilience, this one comes from integration. When equipment, reagents, and supply systems work harmoniously, then laboratories can withstand stock and sustain quality output under all conditions. So we're talking about sustainability outcomes. We're talking about reduced equipment downtime. These are some of the outcomes that we need to see. We know also talking about smarter resource management and improved test reliability, and also strengthen supply chain ecosystem. And so in conclusion, sustainable systems, capacity building and resilience form the foundation for empowered laboratory professionals. And through design, training and collaboration, we can transform healthcare delivery. And so our key message today is to empower laboratory professionals, where we say better healthcare outcomes for all. So it is important that as we work in our labs on a daily basis, then we are able to have good knowledge on how to manage our commodities, how to manage our equipment in terms of reagents, in terms of technology, in terms of the physical structure. For example, how is the setup of the stores? How many times have we gone for supervision only to realize you put your MRDT box on the floor instead of maybe the pellets? How many times have we gone to your store and realized that the temperatures are very high? How many times have we realized that we've gone to your store and it's full of rodents? How many times have we visited your stores and we've realized that it is full, it doesn't have a burglar door? And so these are some of the areas that we must make sure that we are able to secure, to have systems that are working. And lastly, how many facilities have got designated commodity officers for the lab? And how many facilities with the designated commodity officers for the lab have got appointment letters? And 3, how many facilities in our laboratories have got a designated commodity officer with an appointment letter? And 3, has been taken through the commodity management and equipment training, so that they're able to manage these equipments and commodities in terms of the best reagents that are needed, and in terms of the best health medical laboratory in vitro diagnostic products that are needed. How many can we count in our laboratories that have got this knowledge? That is our message today, that at least when we're going back to our facility, then we are able to follow up and ensure that this knowledge is disseminated. Thank you. Back to you, Fred.
Thank you so much, Arthur. It was quite a wonderful presentation, very educative. I'm sure that we have learned a lot, and I can just read a few of your comments. Nicholas Wakesa saying informative. Lucy Mutua saying great presentation. Linus, a very educative session. Betty Kanule, very important and informative. Thank you. Calvin's, good presentation. Benson Lusenaka, good presentation with clear explanation and audible. Betty Chelangat, I believe we all needed this, very informative. And all of us who have really tuned into this presentation, it was quite an impressive presentation that I believe we all needed to know or attend. So I think there are a few questions, and maybe I can start with Benson. He's asking, why is it that some companies sell closed machines? So I think he's asking closed system.
Thank you, Fred. You said who is that? Who is that question?
Benson.
Okay, thank you. Just the way I indicated when we're talking about equipment, one, you have to understand that most companies give the specifications for this particular machines, and the reason why they give protect the machine from unauthorized or unvalidated reagents. Because if they open the machine, then you can buy some cheap reagents which will destroy the machine, for example. 2, they also want to keep their market power. So they can only keep their market power by closing that machine, so that at the end of the day, they remain relevant in the market. So whenever you run out of the reagents, then you have to go back to them and purchase the reagents from them again. So that is one way of ensuring that companies are in the market. So one, I've said, they are protecting the machine from unverified and controlled reagents from other vendors. Then 2, it's a market strategy to ensure that they remain relevant in the market, and they continue ensuring that they're able to sell the reagents that they designated for those particular machines. Thank you.
Thank you so much, Arthur. I think there was a question. This is from an anonymous attendee. Yeah, I think the question goes, how do we validate a fridge?
Thank you. Generally, how we validate a fridge is one, a simple way of validating a fridge and a routine way of validating a fridge is to use a separate thermometer generally, where you ensure that that thermometer is different from the internal thermometer that you are using. So one, you need to compare the temperatures, the room temperatures versus the cold chain temperature. That is one way of ensuring that you're telling that you're verifying the the fridges and ensuring that the temperatures are okay. Then two, after 24 hours, compare the reading to the fridge display. Now, within 24 hours, once you compare the internal temperature of the fridge, you need to introduce a new thermometer so that you have two thermometers, and you want to check one if the thermometers will be giving the same temperatures. So you'll start ensuring that that variation is monitored from that point. So if you realize that the temperatures are not okay in terms of there's a discrepancy between the two thermometers, then you need to first understand that there's a problem. So for many digital models, you can enter calibration mode by holding specific buttons on the power freeze. So in many digital fridges, there's this way of validating these fridges. But apart from that, you need to have calibrated thermometers. So once you have the calibrated thermometers, then you are able to now be sure that that fridge is giving you the exact temperature. So another way that you can do the actual temperature of your fridge, you can place a reliable thermometer that has been calibrated in a cup of water in the middle of the fridge, and you leave it for at least 24 hours to get an accurate average temperature. So then you compare the temperature rating to the temperature shown on the fridge digital display. Whenever you have a fridge, most fridges have got the digital display, most particularly the fridge that we have in most of the labs. So you'll be able to tell that the temperature, the thermometer that you placed, the calibrated thermometer that you placed in the fridge is giving you the same, it's giving you the same thermometer, the reading as the one that you have on the digital display of the fridge. So if they are different, then you will know that the fridge is, you will know that the calibrated thermometer is giving you the exact figures, but the digital display is not giving you the exact figure. So at that point, you need to consult your engineer to also come and help you troubleshoot. Thank you.
Thank you very much for that. And I think someone is asking, someone has made an addition here, Davis, saying, fridge temperature performance can only be checked against a calibrated thermometer. If there is a variance, come up with a correction factor, which should always be factored in the daily readings. So thank you so much for that. And I think there is a lot of comments here from all of you. Esther Lemakoko is saying, I think lab officers require capacity building on validation and verification of the diverse equipment in our labs. It's an area that requires a lot of focus. Evelyn Ogola is saying, thanks for focusing in lab system strengthening. That's the way to go. And I think to all of you who found time to tune in today's presentation, we want to say thank you very much. And I think with that, we've come to the very end of today's presentation. And over to you, Arthur, for your closing remarks.
Thank you, Fred, for moderating this session today. I believe our members have gotten something to take home. And I believe moving forward, we need to ensure that we are able to fast track our health product qualities, our equipment qualities, and our technologies. So there are three areas that we need to have knowledge on: how to manage our products, how to manage our machines, and also we need to have good knowledge on the technologies of different machines that we're having in the lab. That's why we're asking, how many machines do you have in your lab? And how many machines are you able to run effectively? So those are areas that are important for us to understand. Otherwise, from where I sit, this is an area that we need to embrace as a department so that we give ourselves an opportunity to also create jobs for other people. Apart from having the knowledge, We can also create jobs for other people, for our personnel to also do the commodity management in our facilities, so that we reduce expiries, we reduce equipment downtime, and we also reduce service interruptions. Thank you so much, Fred, and back to you.
Thank you very much for that. And I think with that, team, we have come to the very end. And enjoy your weekend. See you next week.